Assalamu alaikum. Today's discussion basically on physiology, the respiratory system. Here an important topics, pulmonary ventilation. Firstly, we have to know what is ventilation. Look at the definition. Ventilation is the mechanical process that moves the air in and out of the lungs. There are two types of ventilation. Firstly, pulmonary ventilation and secondly, alveolar ventilation. In case of pulmonary ventilation, it is the volume of air ventilated the lungs in 1 minute. Its measurement about 6000 milli per minute. And the importance of pulmonary ventilation is that it provides oxygen to the tissue and remove carbon dioxide from the alveoli. Now, look at the basic mechanism that are involved in ventilation. That the expansion and contraction of lungs, which is achieved by two processes. Firstly, the upwards and downwards movement of the diaphragm, and secondly, the elevation and depression of ribs. By these two processes, the vertical and anterior posterior diameter of the chest wall is increase and decrease. In case of increase, it's called inspiration, and in case of decrease, it's called expiration. So, look at the diagram. In case of inspiration, here, firstly, signal from the respiratory centers. It goes through process. At the same time, it's stimulation of phrenic nerve. So, the diaphragm contract and move downwards. And the increased vertical diameter of the chest wall. At the same time, stimulation of intercostal nerve, external intercostal muscle contract. So, increase anterior posterior diameter of the chest wall. On the other hand, in case of expiration, here signal from the respiratory centers. Firstly, no impulse in phrenic nerve. So, diaphragm relax and move upwards. Here, decrease vertical diameter of the chest wall. At the same time, no impulse in intercostal nerve. Here, external intercostal muscle relax and decrease anterior posterior diameter of the chest wall. Now, look at the basic difference between the inspiration and expiration. Firstly, the process. Here, the inspiration is a active process and expiration is a actually passive process. But forceful expiration is actually active process. Secondly, interpleural pressure in case of inspiration here 7.5 and in case of expiration here just 5. And the alveolar pressure in case of inspiration -1 and in case of expiration it's +1. At last, look at the muscle involved in respiration. Firstly, in case of quiet inspiration, the muscle, the diaphragm and external intercostal muscle. In case of forceful inspiration, here lots of muscle, sternocleidomastoid muscle, scalene muscle, anterior serratum muscle, scalenus posterior and at last ali nasi. Here, in case of quiet expiration, it's achieved by the elastic recoil tendency of lungs and chest wall and abdominal structures. Last, forceful expiration is achieved by also lots of muscle. Firstly, rectus abdominis internal intercostal muscle, internal and external oblique, and last transversus abdominis. So this is the short concept on pulmonary ventilation. Thank you.